So I did not always struggle with my weight. No, growing up, I was very thin. I started with my heaviest at 275, and right now, today, I'm 193. It wasn't until maybe about 18 or 19 when I had my first child is when I gained a lot of weight. Then my second and third, it was just out of control at that point. So I did try a lot of things. The gym being one, altering my diet being two, and talking to my PCP at the time, she's not my PCP anymore, about weight loss meds. Initially, I would lose weight with some of the things that I was doing. It's just the weight would come back. So my struggle was keeping it off. So it wasn't necessarily me losing it because I lost it, but it just always came back.
So Tatiana is one of my lovely patients, but she had a dual adrenal switch about a year ago. She presented to the office where we talked about it, her condition, which was obesity, and some other issues that she was having, and her goals that she wanted to achieve. And the reason why we chose that particular procedure, which was the dual adrenal switch, was for long-term outcomes for her, which is one of the operations that give you the highest weight loss with lowest failure rate on long term.
My breaking point was when me and my family took my youngest daughter for her birthday last year in March to a theme park. And it was a ride that I really wanted to get on. I got in the ride, I got seated, but the worker, he couldn't pull the lever thingy down. And I was like, that was my breaking point. So literally like a month after that, I reached out to my insurance and I was like, hey, what are my options here? Because I need to lose weight. The process was really smooth. I ended up having a consultation with Dr. Teixeira after calling the office. I was scheduled for a consultation. Literally like a month and a half after that, I had my surgery. I have so much more energy. So life now is me being much more energized. Like I have so much more energy. I'm not always tired. I do a lot of online shopping now, so I can easily pick out a medium or a large and know that it will fit. I'm much more confident and I feel that I look much more better with pictures now. But day to day is literally like making sure that I take my medicine and making sure that I'm getting my protein in, because those are two very important things.
Before in surgery, that's the easy part. What comes after is the most difficult thing, which is lifestyle changes, psychological issues, nutrition evaluation, medications sometimes, life support. So here at the Institute, this is a full spectrum of taking care of the patient, not before, but also after. Because if you want to be successful, that is the key of the whole magic, which is basically follow up.
So if someone out there is unsure about the surgery, I would definitely say consult with the surgeon to see what your options are. I know a lot of people think that this is the easy way out, and it is not. It really is not. But I would definitely say just consult with the doctor to see what your options are, and if it's something that you want to do after your consultation, then do it.